Hello there, I'm Dr. Robin Saltz from Miami, Florida, and I have been in practice for over 30 years. I would like to talk to you a little bit about diabetes, which is an elevation in blood sugar, which you definitely do not want to have, as it can cause things like heart attack, stroke, blindness, and affect your kidneys. So there are certain things that you can do to prevent diabetes, but first we have to address what can cause diabetes. The risk factors for diabetes can be anything from your family history, if your parents have had diabetes, if it runs in your genetic line, your family, if you are middle-aged, if you are 45 and over. I know I'm more than 10 years over that, so I should be concerned, and I am, especially since it runs in my family. If you are overweight, that is an important thing to remedy because you want to make sure that you're at your fighting weight, as we call it, so that you do not increase your tendency to have diabetes or any other of a myriad of health issues such as cardiac disease, high cholesterol, or elevated blood pressure. So there are some things that your doctor can check you for when you go for your office visit, and the most obvious is an elevation in blood sugar. You want to make sure this number is below 115 when you're fasting, when you come into the office and haven't had anything but water or black coffee. Then again, that number will only reflect what you've been doing for the last day or so. There's another number called the hemoglobin A1C, and that number will tell us how bad you've been, if you will, over the last 90 days. So that number is a little hard to fudge because that number will give your doctor an idea of how controlled your sugar has been over the last 3 months. There are situations where the A1C will be elevated, which tip us off to diabetes, and yet the sugar will be fine because the patient has been very good for the last day or so. Diabetes can also be controlled with the diet, as well as weight loss, and a monitoring of the foods that you eat are very, very important. Things like sugars, obviously, but not just in desserts and pastries and cookies and cake and ice cream, but foods that are thought of as being healthy for you, like fruit. The highest in sugar are the ones I caution my own patients about, are things like cherries and grapes and bananas and oranges and even watermelon. We're coming into watermelon season, so that's not good news for my patients, but everything in moderation is always a good tip, that's for sure. You want to exercise. You want to make sure that you spend energy and lower your sugar and increase your blood flow and your oxygenation, and this is all very helpful to minimizing your stress, which is the third prong there in addition to diet and exercise. Stress can definitely increase your blood sugar. You can watch your diet all you want, but if you're going to be stressed, that sugar is going to go up. So we need to do everything we can to minimize the stress. The CDC says that there are 29 million Americans that have diabetes, and 1 in 4 don't even know that they have this disease, and 1 in 3 are pre-diabetic. So we want to make sure we address this issue before it causes major problems. We don't want the pancreas to overshoot the insulin to lower the blood sugar in your body when you eat sugary things, and after a while that pancreas needs help. So we definitely want to make sure we address this problem before there's any major issue. Everything that we can do to avoid the diabetes progressing, we are going to do. This is Dr. Robin Saltz. Thank you so much for joining us, and we'll see you next time.